I want to talk about the death of the genetic theory of disease transmission today. Prior to, say 30 years ago, everything was caused by genetics. And, of course, the work that I did at the Center for the Biology of Natural Systems, 20,000 autopsies, 10 million chemistries, 10 million slides with special stains looking for pollution. And it turns out that pollution certainly wasn't the cause of death from natural causes, but it was a nutritional deficiency. And while looking at the nutritional deficiency stuff, nutritional deficiencies caused all the diseases that were supposed to be genetically transmitted. So it didn't fit. So I want you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the DVD called Somebody Needs to Go to Jail, and the CD, Public Enemy Number 1. And you're going to be hearing a lot more of that word epigenetics now because it's replacing the word genetics. Let's look at a bunch of diseases thought to be genetically transmitted. Let's start out with type 2 diabetes. 1/3 of Americans are either type 2 diabetic or they're pre-diabetic. This one disease itself is breaking America financially. 85% of all personal bankruptcies in America are due to medical expenses. And again, 30% of all Americans are either type 2 diabetic or pre-diabetic. So let's have a look at this. Well, type 2 diabetic, we've known for 70 years as a deficiency of a single mineral. I've been dealing with this since the 1960s, and I can take your church family and make it an ex-diabetic church family in less than 2 months. I can take your city that you live in and make it a ex-diabetic city, type 2 diabetic city, in less than 2 months. I can take our country, our states, and make our states an ex-diabetic state in 2 months or less, and I can make America a ex-diabetic city, type 2 diabetic city, in 2 months or less. It's a simple mineral deficiency. We've known that for 70 years, and I instituted it because it works in every species of animals. I'm finding type 2 diabetes in crocodiles and hummingbirds and antelope and every kind of critter you can think of, shrews and little hedgehogs and every kind of critter you can think of, snakes and whatnot. Why birds? Why do all these animals have a genetic disease of humans? Well, it turns out it's a simple mineral deficiency. So we've come up with, of course, the book called Hell's Kitchen, which looks at obesity, which is our next little subject here. But Hell's Kitchen, there is a CD that goes along with it. You buy the book Hell's Kitchen from your longevity associate, as for a free copy of the CD by the same title, Hell's Kitchen. And, of course, it talks about obesity first. It's the subtitle is The Cause, Prevention, and Cure of Obesity, but it also discusses type 2 diabetes and the metabolic syndrome. And so that's a great book if you have problems with obesity, you have type 2 diabetes, you have a metabolic syndrome. You want to get the book Epigenetics, and you want to get a hold of the book Hell's Kitchen. Now, obesity itself, people want you to believe that there's a genetic piece to it. They also want you to believe that if you don't exercise enough and eat too much, you're going to call into play that gene and you're going to be overweight and obese. Well, it turns out that none of that's true. Certainly obesity is not genetic in any way, shape, or form. Certainly obesity is not caused by lack of exercise and eating too much. It's a simple mineral deficiency disease. And you take the right minerals, obesity goes away at a rate of a half a pound to 2 pounds a day. And as long as you stay on the 90 for Life program, which gives you all 90 essential nutrients, including all 60 essential minerals, guess what? Obesity will never come back. We get people lose, again, 60 pounds in 30 days. They'll lose, say, 185 pounds, 200 pounds in 7 months, 140 pounds in 100 days. This happens thousands of times a month. It's not an unusual thing because we now know the cause, prevention, cure of obesity, type 2 diabetes, and the metabolic syndrome. And then Alzheimer's disease, oh my gosh, doctors wanted you to believe two things. Number one, it was genetic. Well, no, it can't be genetic because it's aluminum consumption. No, it can't be aluminum consumption because it's genetic. Well, it turns out that Alzheimer's disease is a simple nutritional deficiency disease caused by doctors. Alzheimer's disease is a physician-caused disease. It did not exist 40 years ago, 45 years ago, even by another name. Today, it's number 4 killer of adults over the age of 65. And it's a simple deficiency of cholesterol. You've heard it here. It's a simple deficiency of cholesterol. And, of course, deficiencies of other nutrients make it worse. But you need to be eating 6 or 8 eggs a day per 100 pounds of body weight. Well, I had a nice steak for breakfast this morning and 6 poached eggs. I get better than that, plus all my fruit and stuff, plus my supplements. And Alzheimer's disease, not only is it preventable, but it's also reversible. Wonderful double-blind randomized studies by Johns Hopkins University, a 10-year study, 5,000 people, double-blind, and they gave nutrients to one group, and the other group they gave a dummy pill. The ones getting the nutrients, guess what? Had a 78% reduced risk of getting Alzheimer's disease compared to the ones that got the dummy pill. Or you can say the ones that got the dummy pill had 78% more Alzheimer's disease than the ones that got the nutrients. And then cardiovascular disease. Not a single cardiovascular disease is caused by genetics or cholesterol or saturated fat. Remember, cholesterol is an essential nutrient. Cholesterol deficiency causes Alzheimer's disease. Cardiovascular disease, let's see here, congestive heart failure is caused by a deficiency of a single vitamin. Cardiomyopathy heart disease, where I've done 1,700 autopsies on kids under the age of 10. They're dying of this one, something that causes sudden death in athletes, sudden death in people who do hard physical work. And congestive heart failure is caused by a deficiency of a single vitamin. Cardiomyopathy heart disease, a deficiency of a single mineral. Coronary artery disease has nothing to do with cholesterol or saturated fat. It's caused by inflammation, eating things that produce trans fatty acids, heterocyclic amines, and acrylamides, like microwave popcorn, theater popcorn, fried foods, processed meats, and oils, and so forth. Get a hold of the book Epigenetics: The Death of the Genetic Theory of Disease Transmission, the DVD Somebody Should Go to Jail, and the and the CD Public Enemy #1. And we'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, mammograms are back in the news again today, as they've got a story out here at the American Cancer Society has now put out new guidelines, the first time since 2003, that regulate or recommend when women should get these things done. Headline of this story reads, American Cancer Society changes mammogram guidelines. They say new breast cancer screening guidelines. They bump up the recommended age for the first mammogram from 40 to 45 for women at average risk. And they said the new guidelines also recommend that women transition to every other year screenings after the age of 55. And according to Dr. Kevin Olfinger, he's the chair of the Breast Cancer Guideline Panel and a family physician at Memorial Sloan Kettering Cancer Center. Says additional research that's come out over the past 10 to 12 years has given the breast cancer community a better understanding of the potential downsides of screening. Because that's something you've been talking about for a number of years. They say the recommendations are made with the intent of maximizing reductions in breast cancer mortality and years of life and life saved. But they also are being attentive to the need to minimize harms associated with the screening, the false positives, and the needle biopsies, and the emotional factors a woman might experience. They go on to say one of the key messages of the new guidelines is that women should make informed decisions about when and how often they choose to undergo breast cancer screening. This was all published in the Journal of the American Medical Association. And they say the standard for breast cancer screening involves taking 2 images of each breast. The next step, if there is a concern, would be an ultrasound. And then they go on to say that if you see a suspicious area, there are some areas that may need to be re-imaged in 3 to 6 months, and some may have to warrant a tissue evaluation. Nowadays, the needle biopsies involve a thin needle that go right into the lesion. Typically, they're painless procedures. They say the option to screening every 2 years, beginning at 55, is based on the fact that postmenopausal breast cancers tend to develop more slowly. Because of that, women may choose to either continue annual screenings or move to the every other year after age 55. They say breast cancers before menopause tend to grow more rapidly, making screening every year more important. They say aside from skin cancer, breast cancer is the most common cancer in women of every race and ethnicity. According to the CDC, more than 224,000 every year women are diagnosed with breast cancer. Of that, about 41,500 die. So there you go, something you've been talking about for a while. And, what's the numbers on that, on this false positives? It's pretty high.
Yeah, it's very high, and I don't know the exact number, but, it's above 50%. It's very, very high. And so I like the high-resolution ultrasound. There's no radiation. 1 mammogram gives you the same amount of radiation as 500 chest x-rays. Why would a woman want to do that? And Harvard Medical School came out, that's almost, got to be 12, 15 years ago now, said don't do them. The government came out 12, 15 years ago, said don't do them. And, of course, the doctors are sort of parsing their words here. They say, yeah, after 3 months, if we're not quite sure what the first imaging showed, let's re-image it. So they're using now the words re-image it rather than get another mammogram. Because if they're smart, they'll actually use a high-resolution ultrasound, which has no radiation and gives you the same amount of information, in some cases more. I don't like biopsies. If there's a lesion the size of a small grape or a pea, you either just do a lumpectomy, take it out, with a little bit of normal tissue around it. I don't want to be putting needles in it and dragging that stuff through the healthy breast tissue and spreading, if it is cancer, you don't want to be spreading it, right? So, okay, ladies, beware. Remember, breast cancer is self-inflicted, it's not genetic. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's see. We already talked about the pearls of wisdom, so let's go to callers.
All right, let's head to New York. And Cheryl, you're on with Dr. Wallach.
Oh, Cheryl, you're on the air.
Good afternoon, Dr. Wallach.
Hi, how can we help you?
I have been using longevity products for approximately 1.5 years and have experienced many positive results, and I truly thank you for that.
Thank you. What's
and
up?
Today I received my first blood test results since I started with longevity, and most results were positive, I'm glad to report. Now, I do have, however, 3 questions regarding the results, and I want you to know that my primary physician has agreed to listen to this broadcast archive to hear your responses.
Okay.
So my first is regarding my high vitamin B level, which is greater than 2,000 with a reference range between 200 and 1,100 pg/ml.
Okay, now when you say vitamin B levels, wait a minute, are you talking about vitamin B12, or are you talking about B1, or
B12.
All B vitamins, or?
B12.
Okay. All right, well, you have to appreciate that the reference range is based on people who do not supplement. It's based on people who just eat food. And meat eaters and people who eat eggs will be between 800 and 1,100. But people who eat liver will be about 2,000. And so you're getting a lot more B12 than the average person who's just eating diets without liver. Okay, so that's the answer to that question. Remember, the references are people who do not supplement. It doesn't include people who supplement. I've been taking the B12. Yeah, I've been taking the 90 cents of nutrients twice a day for 68 years, and my B12 runs higher than the reference. That's because I've been supplementing twice a day for 68 years.
Okay, well, I have
There's no negative.
I've taken the D-Stress, the BTT 2.0 Ultimate Daily, which all have B12, and
exactly.
I have noticed some tingling, my mouth, and some in other places, and I was wondering if this could contribute to the tingling effect that I've been experiencing.
Well, all things are possible, and so I'm not silly enough to say no, because it could be many things. You could have degenerative disc disease in your neck, can cause tingling in your hands and your face. You can have osteoporosis of the skull. Let me ask you a couple quick questions here before we go on to the other questions you have. Let me ask you a couple of questions. Oh, that's sound here, so we're going to run to one of those message moments. Hang on, we'll come back, then I'll ask you my questions. Okay, Doug, let's go right back to New York and Cheryl. Let me ask you a couple of quick questions here, Cheryl. Did you ever have asthma or bronchitis?
No.
Okay. Did you ever have skin problems, eczema, dermatitis, psoriasis?
Yes.
Okay. Well, then you have a gluten intolerance, okay? And yourself and your spouse and your dog and your cat and your bird and your fish, kids, mother-in-law, everybody living in the household has got to be gluten-free. You got to get grain-free animal foods, and everybody else in the house has got to be gluten-free because of cross-contamination of laundry, food preparation surfaces, the couch, where everybody watches TV, and the bed you sleep in with your spouse, and so on. And so that's the one thing. Another thing, sometimes people doesn't take much. Even non-flush niacin, B3, can cause kind of tingling, itching, that kind of stuff. And so you just need to make sure that's not what's going on here. So what you can do, the thing that has the most B12 in it would be the de-stress capsules. So why don't you leave the de-stress capsules out, say for 2 weeks, and see if that doesn't reduce or eliminate that tingling. And then, of course, you have to be drop-dead gluten-free. Again, I can't stress that enough because you have a history of the skin problems, which means you do have a severe gluten intolerance. If you have children, you need to pass that information on to them. Your siblings, your brothers and sisters, if your mom's still alive, you need to pass that information on to her. Okay, and so let's start there with the tingling in the hands and face and so forth. Okay, so let's go to the next question.
Yes, the next one is, I am working to correct a calcium deficiency, and my current reading is 9.9 with a reference range of 8.6 to 10.4, and I want to know what you would consider to be a healthy range for me, considering I am trying to correct a calcium deficiency.
Okay, and of course, you could have a calcium deficiency even if you're supplementing appropriately for your weight with the healthy bone and joint pack or the healthy brain and heart pack with the extra glucogel. I mean, even if you're supplementing properly, if you have a gluten intolerance, you might be only absorbing 10 or 15% of the nutrients you're taking in. Okay, so that's a possibility. If you've been taking this for a year and a half, you shouldn't have a calcium deficiency. Well, you're within the reference range if you're 9.9, and certainly 8.5 to 10.5 is a reference I like to use. When you get above that, when you get to, say, 15 or 20 or something like that, you have a raging calcium deficiency, and your parathyroid glands are pulling calcium out of your bones, and so you're right in that range. Now, the scary thing here is, Cheryl, that you really can't trust that reference number because if you have osteoporosis and you've had a history of kidney stones or bone spurs or noisy joints or fractures or anything like that, or just by bone density tests you have osteoporosis, what happens here is your body works to maintain homeostasis. It wants to stay in the normal reference range. So your parathyroid glands will keep pulling calcium out of your bones to maintain your blood calcium levels. Sometimes they overreact and you get elevated blood calcium. It still means you're not taking in enough calcium in your diet or you're not efficiently absorbing. Okay, so you really need to look at what you're eating. Okay, you can't eat oatmeal. Even gluten-free oatmeal, there is no such thing as gluten-free oatmeal. The gluten in oatmeal is called gliadin, and even though you call it by another name, it's still gluten. So there is no such thing. So no wheat, no barley, no rye, no oats, okay? And then we'll come back. We'll take one more shot at the next question after these messages. Okay, Doug, let's go right back one more time here to Cheryl in New York. And so what's the third question here?
Okay, I really appreciate you. My total cholesterol reading is 296, and my non-HDL cholesterol is 192, which are both considered high. How would you respond to those? Sure.
Okay, well, this can be kind of a Char thing here. Char, you there?
I'm here.
Okay. You've heard so many versions of high cholesterol and low cholesterol. What do you think about Cheryl, whose blood cholesterol is did you say 296, Cheryl?
296 with a range of 125 to 200.
Okay.
I would say it's good, because the Eskimos' cholesterol is over like 350 to 500, and they never get heart attacks. So
yeah.
High is good.
Yeah, basically, Char is quite correct here, Cheryl. The normal range is from the University of Colorado back in the 1990s, where they did a big study on cholesterol levels and heart attacks and so forth. And in that study, published, says that blood cholesterol should be 220 to 270. 200 and below are way, way too low, and that's what caused Alzheimer's disease. Doctors who insisted that their patients get on a cholesterol-restricted diet, no egg yolks, no meat, absolutely no buttercream or lard, physicians have caused Alzheimer's disease. It's a cholesterol deficiency disease because the myelin in the brain, the insulation material in the brain, is primarily cholesterol. And when you get on a cholesterol-restricted diet, you get on cholesterol-lowering drugs, like statin drugs, you cannot reduce your cholesterol that much and not get Alzheimer's disease. I mean, we're talking about double-blind studies for 10 years, 5,000 people, randomized, big studies from the Johns Hopkins School of Medicine in Baltimore, Maryland, very well respected. Of course, I was saying these things back in the 60s and 70s because I'm seeing all this when I did my 20,000 autopsies and 10 million chemistries and everything, that what they were saying about Alzheimer's disease was absolutely false. It turns out the whole thing with cholesterol was an advertising campaign paid for by Procter & Gamble. They gave the American Heart Association $1.7 million to demonize cholesterol and saturated fats so that Procter & Gamble could sell Crisco. Okay? That's the short version of it. And this was a full-page article in the Wall Street Journal about 2 years ago. I couldn't find the pivotal study that showed that cholesterol and saturated were bad. I looked for 35 years to find the pivotal study that showed that cholesterol and saturated fat were bad. I never could find it. And the reason why, Cheryl, I couldn't find it was it never existed. The whole thing, demonizing cholesterol and saturated fat, was a sales campaign by Procter & Gamble. And, of course, it was fostered by the American Heart Association because they paid the American Heart Association $1.7 million to endorse Crisco as a healthier way to eat. It was all an ad campaign. And they've killed billions of people around the industrialized world with that false claim. The cholesterol and saturated are bad. So you're way too low. You're way too low. You need to get up in at least the mid-200s, 250 to 275. 350 is really where you want to go. Okay, Doug, you got time to start another one?
Yeah, we sure do. Let's head to Riverside, California. And Danielle, you're on with Dr. Wallach.
Oh, Danielle, you're on the air.
Hi, Dr. Wallach. I recently had a baby 2 months ago.
Congratulations.
And thank you. I ended up having an emergency C-section, and right after surgery I was experiencing shortness of breath, and I could barely even walk or hold my baby. A couple weeks after I got out of the hospital for having my baby, I went back and I was diagnosed with a blood clot in my leg and in my lung. And they sent me home, and I ended up going back to the hospital again because I was having a really rapid heart rate when I would stand up. It gets up to about 180 just from standing up and walking very little. And they diagnosed me with postural orthostatic tachycardia. And I was wondering if you have ever dealt with that or know anything about it.
How much do you weigh? We only have a few moments here, dear, so how much do you weigh?
128.
Okay, and how tall are you?
5'2".
Okay. Yeah, so you might be 5'2". I'd like to see you weigh maybe 110 kind of stuff, 115, so you might be, 10, 12, 15 pounds overweight, depending on your build. Let's see. From the blood clot standpoint, blood clots are caused by what, Char? What causes blood clots? A deficiency of?
The deficiency of EFAs.
The omega-3s.
3, 6, and 9, yeah.
Yeah, there you go. And ratio problems between 3, 6s, and 9s. And so at 128 pounds, what would you give her to make sure that she has enough so this doesn't happen anymore?
I'd give her about at least 6 EFAs a day, maybe more.
Yeah, okay, you're exactly right. So one Healthy Brain and Heart pack would pull that off because she'd be able to take 3 of the EFAs for breakfast and 3 of the EFA pluses at dinner or vice versa. And I would also, what would you give her to help the body, let's see here, to absorb or to dissolve, I guess that's a better word, dissolve the blood clots?
I would give her the nightly essence because it has nanokinase in it, which dissolves blood clots.
There you go, nanokinase. Exactly right. Have your Danielle, you want to take 3 of the nightly essence enzyme mixture at breakfast and 3 at bedtime with a glass of water. That'll be 2 bottles a month. And then for the tachycardia, and because you stand up and that happens, it could be a postural thing, okay? And they said postural tachycardias. And so what would you do for, say, degenerative disc disease, bone spurs in the back maybe, causing pinching nerves? What would you give her?
I give her glucogel.
Very, very good. Yeah, you need to, I'd go ahead with 2. Since you're having symptoms like that, I would go ahead and take 2 bottles of glucogel, large bottles of glucogel, take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And the goal here is to support maintenance repair of the disc between your vertebrae, push the vertebrae apart so that when you either lay down or you stand up, your heart doesn't race. And that's going to give you all 90 essential nutrients. And it's going to put you in the right position to reduce your risk of more blood clots. And as Char said, the nightly essence with a natokinase actually will help dissolve the blood clots you do have. And so give us a call every couple of weeks. Let us know how you're doing. And congratulations on the baby, and we're glad everything's working out because you'll be a new woman here. You just need to do all this. And particularly if you're breastfeeding the baby, all these nutrients are going to go through the breast milk and go into the baby. But do stay away from the bad foods, no fried foods, no processed meats, no oils, no gluten, and maximize your absorption of nutrients. Okay, Doug, how much time we have here?
We got enough time to get one started here. Let's head to Los Angeles, California. And Yvonne, you're on with Dr. Wallach.
Okay, Yvonne, you're on the air.
Yes, the reason I'm calling is that I called last week and I was diagnosed with stage 4 triple-negative breast cancer, which spread to the liver. But what I did not let you know is that my doctor put me on the chemo Gemzar. I have ascites that drains every 2 liters every other day. I have a tumor that's pushing, a large tumor in my chest that's pushing through the skin. I have cancer nodes in the chest. My weight's about 90 pounds. I have low blood pressure. And I'm just concerned about, I have fatigue and dehydration, but absorbing nutrients because
Sure, I understand. Okay, well, hang on. We'll come back. We'll give you some information that's going to certainly improve the quality of your life and give you more time. And we'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 90 for Life Crusade. And Doug, let's go right back to California, Yvonne. Okay, I'm going to go ahead and take this one because we have another caller here we'll try to get in. And basically, Yvonne, obviously you have to get rid of all the bad foods that drives cancer. No fried foods, no processed meats, no oils, no gluten. Got to stay away from all that. I stay away from carbonated drinks because we're going to maximize absorption of nutrients. At 90 pounds, I go ahead and take 1 healthy brain and heart pack per month. Go ahead and get another bottle of selenium, so you can take 3 of those twice a day. I get 2 bottles a month of the Ocean's Gold, so you can take 3 of those twice a day for the sea cucumber that's in there, great for your immune system when you have metastasized cancer, stage 4 as you have. I would also take the 2.0 Beyond Tangerine tablets, and I would go ahead and take 3 of those twice a day. It'll be 2 bottles a month, and that's going to get you up around 320,000 auric points. Get your immune system up there, again, to have your own immune system defend you against this cancer. And again, stay away from the bad stuff by taking these supplements. You should have a better quality of life. And make sure you're eating eggs every day. That's going to help your blood pressure because you need a little bit more protein, perhaps, floating around your blood. Haven't seen your blood work, but usually when you have low blood pressure, it usually means low blood protein. And so I would go ahead and take, let's see here. Cheryl, what would you give somebody who needs to digest more protein and absorb more minerals? What would you give them?
I give him the shakes, the whey shakes.
Yeah, and what would you do to, again, digest the food better?
Oh, and ultimate enzymes.
Yeah, the ultimate enzymes, very good. Yeah, go ahead and take one of those, say, 2 minutes before each meal. Yvonne, the ultimate enzymes, take 1 before each meal, like a minute before, and a couple ounces of water. And that's going to help absorb and digest the protein. So I want you to have, if your weight, 90 pounds, I want you to have 4 to 6 eggs a day. Okay, give me a call every 2 weeks, certainly every time you go to the doctors and get more information. Let's see here, Doug, we have time to try another one?
Yeah, let's head to Aptos, California. And Judy, you're on with Dr. Wallach.
Hello, Judy, you're on the air.
Great. Dr. Wallach, 6 months ago, my husband completely and we both changed our diet completely. And his main problem was vitiligo, and mine was arthritis. So the vitiligo, his hair has changed back. He's dropped 20 pounds. We've seen a lot of good results from everything that he's on. And you said 9 selenium, 9 EFAs, 9 HGH, plus the healthy body fat, okay?
Mm-hmm.
So is there anything else that he should be taking, and what should we begin to see as far as his vitiligo?
Okay, well, make sure remember he's on a gluten-free diet, but I would also have him take hair, skin, and nails. Great product. It helps support skin health. And so I'd have him take, what does your husband weigh?
Right now he's 165, and he's about 5'10".
Okay, I'd go ahead and give him 3 twice a day. It'll be 2 bottles a month of the hair, skin, and nails, but otherwise keep doing what you're doing. The fact that his hair color is coming back, that says he's absorbing. And the skin takes a little bit longer than the hair does. Okay, and tell us about yourself.
I'm on the 6 selenium, the ESAs, let's see, the HGH, I do 6, and I'm 5'5", 145.
And why were you taking all this?
I'm sorry?
What, did you have a health problem?
Well, I mainly wanted to, I have the white spots as well, not the vitiligo, but I get these white spots, and then my arthritis.
Okay, well, the arthritis, how much glucogel are you taking?
6 a day.
Okay, Cheryl, what would you do? She's 145 pounds, and she's maybe not real happy about the degree of response she's getting. What would you do instead of 6 glucogel a day? How many would you give her?
I take 12 as a maintenance.
And how much do you weigh?
About 110.
Yeah, okay, so yeah, I would go ahead and take 15 a day of the glucogel, okay? And so, Judy, I would get to 2 large bottles a month of the glucogel, so you can take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. Really crank down on the gluten. Make sure even the dog, the cat, the bird, the fish have grain-free foods. And then call us every couple of weeks on your husband's skin color and your white spots. And, of course, you could have a fungus. Tinea is the name of it, and might not be vitiligo. At any rate, thank you so much, Char. Super job as usual. Thank you so much, Doug and Richard. Superlative job. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
The antioxidants found in many fruits and vegetables are known to help support and promote good health. Research has also shown that dark chocolate, once known as the food of the gods, is rich in healthy nutrients. In fact, dark chocolate is higher in antioxidant content than any other food. Youngevity has combined a proprietary blend of velvety rich dark chocolate with whole fruit pulp and whole fruit juice extracts from mangosteen, goji or wolfberry, acai berry, and cherry, along with vitamins and minerals, producing a smooth, rich, delectable concentrate called Cocogevity. It tastes so great, I sometimes drink it right out of the bottle or pour it over ice cream. Cocogevity is highly bioavailable, meaning your body will absorb and make use of all of these healthy nutrients. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the ultimate tangy tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. When those aches and pains in your knees, elbows, hands, shoulders, and back crop up, reach for Youngevity's CM Cream. Put CM Cream on a Q-tip and put it in your ear canal for relief from headaches and sinus pressure. A topical temporary relief from minor aches and pains of muscles and joints associated with arthritis, strains, sprains, and simple backaches. Why take aspirin or non-steroidal anti-inflammatory drugs that can cause stomach bleeding and liver damage? Just apply CM Cream liberally to the affected areas, and within 20 minutes or so, you'll have relief from those nagging minor aches and pains. You'll feel better for up to 4 to 5 hours. So the next time you have achy joints or muscles, do what I do. Reach for CM Cream for relief. And for systemic relief, reach for CM Plus capsules. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate. And don't forget to ask about home-based business opportunities.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Youngevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound. Turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
If you're the type of person who likes to volunteer and help others, this should interest you. What better way to help people than to help them overcome their health challenges? Youngevity has been helping people overcome their health challenges for years. Our approach to health is drastically different than medical doctors who mostly only treat symptoms. As a veterinarian, Dr. Joel Wallach discovered that many common disease states are actually preventable and reversible. Our mission at Youngevity is to educate Americans about their own health. If you like helping people, join us in our fight to save America. While you're helping people prevent and overcome health challenges, you will also be able to build a lucrative home-based business. So what are you waiting for? Come join us and help save America. If you've decided to join us, call your local Youngevity associate to find out how you can arm yourself with the knowledge that's needed to save America.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I gotta tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Youngevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.